How can one exactly do monitoring of BP at home?
There is a stigma still running in a lot of people's head that are home measurement of BP accurate? Are they reliable? If it is, how can we do it?
So often people, when they check their BP, the numbers may vary. So can BP fluctuate during the day?
In your ambulatory blood pressure monitoring, if you have absence of that nighttime dipping, that means you are very much likely to be developing hypertension in the next 2-3 years. And that's why it's important to understand.
To help improve blood pressure, what a patient can take as a food, as lifestyle habit, what they can do to make it better?
Lifestyle changes alone can bring down your blood pressure, the systolic by 20 and the diastolic by 10.
We often see that people goes into anxiety who has hypertension and they want to lose the weight and they go for crash diet.
Yes.
So what food, vegetables exactly you are suggesting here, and are you suggesting a crash diet for those patients?
Fried food not only takes a lot of oil, it actually absorbs a lot of salt along with it.
Hello and welcome to Heart Talks,
where we bring you expert insight to take charge of your heart health. I'm Tanaya, your host for today, and today we're going to talk about something that affects millions of people silently: hypertension or high blood pressure. Why is it called the silent killer? How can you know your numbers? And most importantly, what can you do about it? Let's find out from our expert for today, Dr. Amit Kumar Sarkar. Hello, doctor. Welcome to Heart Talks.
Hello.
So, to begin with, what is exactly hypertension?
Hypertension, as we know it, is just the elevation of blood pressure in colloquial terms. But hypertension is not just about this rise of blood pressure. Hypertension brings with it a lot of potential side effects that not only kills the patient, but it also brings down the quality of life for the patient. Just like, as you can understand, that hypertension causes kidney damage, it can cause heart damage, it can cause brain damage, and colloquially we call them brain stroke, heart attack, kidney failure. And those are the things that doesn't always kill the patient, but it actually brings down the quality of life, makes people bedridden, sometimes makes people dependent on lifelong therapies, lifelong going to the hospital again and again. So it's not only about the blood pressure being elevated, but it along with it brings a plethora of problems that sometimes make the life of the patient miserable.
That's quite serious. But doctor, when we talk about high blood pressure, what numbers you are talking about exactly?
Okay, now that's a very interesting question, because the number is a fixed number. You can measure the BP in a doctor's clinic, you can measure the BP in your home, you can measure the BP in today's time. You can actually have a BP measurement throughout the day over a 24-hour period and have an average of all the readings. So if you come by the guidelines, if you are in a hospital clinic, in my clinic you come to me and your pressure is above 140 or the diastolic blood pressure is above 90, I will call you hypertensive. But if you are in your home and you are measuring the BP in your home or in a cozy environment, but your blood pressure comes above 135/85, I have to call you hypertensive. On the other hand, just as I told you, there has been some recent developments where you can measure the BP throughout your day, and that's called ambulatory blood pressure monitoring. So you are given a device that's plugged onto your body. You are doing a routine activity, whatever you are doing, and the machine takes multiple readings throughout the day, and it takes an average for the whole day. But that reading, if comes above 130/80, I have to call you hypertensive. So in a nutshell, if I tell you that it's not a single value, the most important is where you are measuring the BP. If you are doing in a particular setup, the value changes. So last point, if you are going to a doctor, it's just your value automatically rises a little, but when you are in your home setup, even a little lower value, I have to call you a hypertensive.
This is really informative, doctor, and it's very helpful for patients to understand their heart readings better.
So, doctor, earlier you mentioned that hypertension can increase the risk of heart attack, stroke, and kidney failure as well. So, why is it called the silent killer? Why it has given such a serious name?
Yes, I think the answer to this question will probably hold the most informative part throughout whatever we'll be discussing today for the general people, because you are having a fever, you understand your body temperature has gone up, you are having a headache, you are feeling pain in your head, and you will rush to the hospital. But when you are having hypertension, and maybe it's slowly damaging your heart, and yes, there are some symptoms, but it's not affecting you that much. So you are not really not wanting to jeopardize your daily life. Don't have time to go to your doctor. So okay, you are waiting, you are doing your daily life, but it is silently affecting your heart, it's silently affecting your kidney. And unless you are going to a doctor and doing your checkup, some blood tests, some urine test, some other kind of investigations, you never know what's going on in your body. And till the moment it gives you a symptom, maybe sometimes it's already too late. So that's why I think it is called a silent killer, because it doesn't always really give you that symptom that you have to rush to the hospital at that very moment, but it is causing the damage in the background. And the moment it has given you a symptom that forces you to go to hospital is sometimes pretty late. So that's very important question, that it's not about knowing what symptoms, but sometimes it is the awareness that you can have hypertension causing some kind of heart damage, kidney damage, without having any palpable symptom. That's why it is very important to understand that it's a silent killer, because unless people understand that you can, someone sitting right now in your home, you can be having a maybe hypertension related kind of heart disease or kidney disease without actually having any symptom, unless you go and visit a doctor and do some test. So that's why it's very important to realize this fact, that it can happen that it's doing some damage, but you're not realizing it. So it's very important to go and have the things checked uh, at a regular interval at certain age of your life.
Absolutely. So, doctor, if someone is having high BP, are there any symptoms they should watch out for?
Yes. Uh, High BP, regardless of the value, can be asymptomatic. But yes, when the BP range crosses a certain level, like 170, 180, there can have some symptoms depending on the organ it's affecting. So if we start from above and go down below, so the first symptom I can think of is headache. And not only headache, I must say the headache that's predominantly affecting the posterior part of our head, that we call in our language occipital headache. So the posterior part of our head having pain, yes, you can have a high BP giving you a symptom. Next, if I go a little down, coming to our nose, you can be having nosebleeds at very high BP. You can be having nosebleeds. That can be a symptom for high bleed. Okay. Now, if I go a little down, coming to our chest region, you can be having severe shortness of breath, palpitations, chest tightness or chest pain, and sometimes you can be having severe breathlessness. So those can be some symptoms for your high blood pressure. And if I go even a little more down towards the feet, you can be having pedal swellings, you can be having tingling sensation in your hands and legs. That can be a little bit distinct but a prominent symptom of high blood pressure. And finally, I must tell you that irrespective of the blood pressure value, it doesn't matter if you're having 160 or you're having 260, you can still stay asymptomatic. But yes, it can give you symptoms, but I think you should not wait for those symptoms to come.
Absolutely. So, that makes us totally aware of the silent killer. So, doctor, Let's dive a little bit deeper. So, what exactly causes hypertension in a human body?
Okay, now that's a very complicated question to start with. So, if I can start the answer in a single line, the most common cause of hypertension is unknown actually, because mostly we call in our language that it's a genetic problem. But beyond the genetic thing, there are some secondary causes of hypertension where you have a particular disease or a state where you do not have hypertension in your genes, that is, you do not inherit the genes for hypertension from your birth, but you will develop hypertension because of those things. Now, if we just get some time to discuss a few things, uh, the most important secondary risk factor for hypertension is your daily stress. If your daily life is extremely stressed, you're not getting enough time for sleep, your food habits are extremely erratic, you are indulging in a lot of addictions, mainly smoking. So those are, I think, in today's life, especially in the younger population, who maybe 30 years back, who were not supposed to be developing hypertension. But in today's time, we are seeing a lot of patients who do not have any history of hypertension in their families, in their relatives. But because of their stressed life and not so healthy lifestyle and diet, and maybe sometimes addiction, they are developing hypertension. And I think from the secondary points, this is the most important secondary cause of hypertension in today's time. Apart from that, there are lots of other reasons where you can develop hypertension. Like you can be having some kidney disease that can secondarily lead to hypertension, like a patient of diabetes who developed a kidney disease, who did not have hypertension to start with, but he or she will be developing hypertension if the kidney disease is not controlled over a period of time. uh, then if you are having, we have a gland called adrenal gland, and there are some diseases like complicated names, but pheochromocytoma or hyperaldosteronism. To make it simple, there are few glands in our body. If they start to function above normal, they are functioning above normal, they will produce some hormones that will lead to hypertension in our body. And that's actually a boon, because if we treat that disease, hypertension becomes totally reversible. So sometimes we think that we developed hypertension and it becomes a lifelong problem. Yes, sometimes it is, but sometimes if we are having a secondary cause like a tumor in our body that is secreting some kind of hormones that's leading to the elevated blood pressure, if we are able to remove that tumor, the blood pressure becomes normal without any drugs and all. Apart from that, if we are having disease of a thyroid gland, we call it hyperthyroidism, where the thyroid gland is acting above normal, we can have hypertension. If we are having a disease where it's called an obstructive sleep apnea, what it is a disease where people are usually obese and they snore a lot at night, and because of that they do not have a sound sleep throughout the night, and they wake up very tired, they're tired throughout the day. And this is another very important history that I must take from my patient, that what is your sleeping habit, it is good or not. Sometimes the bed partner gives a fantastic history, no, he or she snores a lot, because I don't know when I'm snoring, my bed partner will know. So it is very important to talk to the bed partner also, because obstructive sleep apnea in today's time, again, a very important reversible risk factor. Why I'm emphasizing so much? Because it is reversible. I can reverse the blood pressure without doing too much focus on the blood pressure drugs, because if I can reverse the BP, I can prevent him or her from a lifelong problem by doing something that is easy for him or her. So again, apart from that, sometimes it is not very common, I will say, but some drugs like cocaine or some sympathomimetic drugs, maybe not that common, but I must be keeping in mind, one must keep in mind that in their scenario, if it is common, then it can really lead to a lot of hypertension. And in the end, I must tell you that uh, all the causes, there can be 10, 15 more causes of hypertension that can be reversible. But still, in today's time, I must tell you that hypertension is a genetic problem. If you have hypertension in your blood relatives, then you are already have very high chance of developing hypertension. And probably still today I cannot do much to prevent that. I have a lot of things to treat that, but I probably not a lot of have to prevent that. Yes, I can tell you some things to about your lifestyle, some things about your diet. Yes, you should be more aware if you are having hypertension in your blood relatives. But if you are having hypertension in your family tree, you are more likely than not to develop hypertension, and you must be very much aware of that.
That's wonderful, doctor. So, habits and heredity can play a big role of causing hypertension. So, doctor, are elderly people at higher risk of having high BP?
Okay, that's a very interesting question, because we think that someone is having a hereditary problem, so he will be developing hypertension from very start of his life, because the genes doesn't really change in our body. We are born with a gene, and it kind of stays with us throughout our life. So if I am having a gene for hypertension, why am I not developing the hypertension right from my birth? And yes, it's true that people do develop hypertension as they progress through the age, and age is, I think, one of the most important risk factor for developing hypertension. So that brings us to a very important discussion for today, where I must give you a little insight into what really leads to the development of hypertension. If I can take the idea of building a house, where we first bring things and make a structure, make a base structure on which we develop floor by floor, and then in the end we build the house. So it's like those genes are like the building block, the base structure, without which we are very much unlikely to develop hypertension. But the genes only are not the culprit. It's the environmental factors, our lifestyle, our diet, all those things together play another very important factor for developing hypertension. And as we go through our age, those those toxins coming from maybe our diet, coming from the environment, maybe from our lifestyle, those things pile up, and slowly those toxins help those bad genes to express themselves. If I am not very wrong, those genes were always there in our body, but they were not expressing themselves. It's like having a wicked kid in our house who is there, but he is not doing those wicked things because he is not having wicked friends. The moment a few five wicked friends come in the house, now that wicked friend together becomes a nuisance. That's what the genetic factors in our body is. They don't express themselves unless they get those factors, some environmental factors, some genetic, some lifestyle issues, or maybe some diet. Together they lead to the expression of hypertension. And that's why age becomes a very important factor, because as we go through our age, those toxins, those risk factors cumulatively produce hypertension from those genetic issues that we are born with.
That's wonderfully described. Understood. So, doctor, these days we hear about checking blood pressure at home, at our own home. So, how can one exactly do monitoring of BP at home?
Okay, that's a wonderful question, because we always can't go to a doctor just for the measurement of BP. Also, I think home measurement of BP is being given more and more importance in today's time. But there is a stigma still running in a lot of people's head that are home measurement of BP accurate? Are they reliable? And if it is, how can we do it? So firstly, I must tell you that home measurement of BP, it is accurate and it is really reliable. Does it really replace the measurement done by a doctor with a handheld machine? Yeah, it does not replace it. But the importance is if one can do the checkup properly, then it is really, really important that home measurement of BP can be done with a lot of certainty. Now, the next thing is, how can one do the measurement? Well, I must tell to the common people that the measurement of blood pressure at home with an automatic machine can be done if one can take some precaution. What are they? Number one, you must be having some moderate amount of diet, not too much diet. You can be having empty stomach, but it is not always needed. But one must not be having a heavy meal before measurement. Number one. Number two, it is better that you are sitting and your hand in such a position that the blood pressure cuff, the cuff that you wrap around your hand, it is at the level of your heart. This is number two. Number three is you take three readings. Number one, number two, number three, 5 minutes apart. So you take a reading now, you take a second reading at 5 minutes and a third reading at 10 minutes. And you discard the first reading actually. And you take the second and the third reading and you put an average of that. That is very, very close to the measurement we take in our clinic with a handheld instrument. So if one is little bit patient with the measurement, takes the proper precaution, then a home measured BP, even by an automated blood pressure machine, gives you a very close but perfect answer to your blood pressure value. And why is it important? Because there are a few occasions, few people who becomes extremely anxious when one goes to the doctor and becomes very tense that what's going to happen. My blood pressure probably is going to be very high. And in that anxiety, his or her blood pressure automatically rises. So if I am seeing a patient in my clinic and the blood pressure is 160 by 80, so I have to call him or her hypertensive. But maybe that he or she was just being anxious, and I cannot rule that out. And that's where the importance of blood pressure measurement at home comes to the picture. So if I'm seeing a patient for the first time and he or she does not have that much of family history, maybe young people of 35 years of age doing perfectly fine, before stamping him or her as an hypertensive, I think it's very important that I tell him or her that go home and have a home measured BP and then come back to me after 7 days. So home based BP monitoring is very important. It is accurate and it is reliable if one follows the precautions.
Thank you so much.
So now you know how to measure your BP at home.
So, doctor, if somebody gets a higher reading, what should they do next?
Okay, yes, that's very pertinent because we just heard about the process that one must follow. Yes, you have taken three readings at 5 minutes interval. You are sitting upright with your hand in the proper posture, and now you have really got a high reading. So, if it is in the range of 160 by 90, I think one can be a little bit patient, calm down. You can have the same thing repeated the next day. If it is coming really elevated for 3 consecutive days, I think one must go to the doctor. This is number one. Number two is, if the reading comes above 180 by 90, then I think one must rush to the nearby doctor.
Clear and crucial advice. Thank you, doctor. So often people, when they check their BP, the numbers may vary. So can BP fluctuate during the day?
Yes, that is a very important knowledge for common people because we see patients who come to the clinic and say, I did a measurement at home and it was coming normal, but now in the clinic it's coming high, doctor. So is my machine wrong? So the first thing we say that, did you do the measurement at the same time that it is being measured now? Because yes, our blood pressure normally does have a diurnal variation. That means our blood pressure starts to rise just a few hours before we wake up. It goes up and around, depending on our diurnal cycle, it actually goes, that is the highest, and then through the evening, through the night, it starts to fall. That's called the nighttime dipping. And if we do the ambulatory blood pressure monitoring that I was talking in the initial part of my talk, that we can actually have the throughout the day the 24-hour blood pressure monitoring, we will see that even in normotensive population like a normal people, he or she will be having a nighttime dip, that is a decrease in his or her blood pressure level. But if that dipping is absent even in a normotensive people, like I was talking about having a family history. Now, someone, if he or she asks me that, doctor, my family history is very high, but my BP is still normal. So, am I at risk today? So, that's a very important thing to learn about the nighttime dip in your ambulatory blood pressure monitoring. If you have absence of that nighttime dipping, that means you are very much likely to be developing hypertension in the next 2-3 years. And that's why it's important to understand that yes, blood pressure does vary. It is highest in the morning hours, it is lowest at the night hours, and that's why it's important to have measurement of your BP. If you are doing home based measurement in a single same time every day, that's why it is very much important to have this knowledge. Very good question.
Wonderful.
That's really insightful information. It's not just about number, it's about the pattern and what it can reveal.
So, doctor, many people having high BP nowadays. So, what practical tips you can give to manage? You want to give to people to manage BP?
Yes, so now a patient has developed hypertension even after doing a lot of preventive measures. He or she has developed hypertension. So, to be very frank, I have three modes of treatment in my hand. Two of them are to be done by the patient, and one is onto me. So, the two of them that the patient has to do is, number one is lifestyle, and number two is healthy diet, and number three that I can do is drugs. These are the pillars of the treatment.
To help improve blood pressure, what a patient can take as a food, as lifestyle habit, what they can do to make it better?
Yes, just as I was speaking about the lifestyle changes and the dietary modifications, if I come in the lifestyle part, I must tell you that keeping aside the diet and the drug, lifestyle changes alone can bring down your blood pressure, the systolic by 20 and the diastolic by 10. So if you are coming to me and you have a blood pressure of 140 by 90, and if you are physically fit, so if I advise you a proper diet, daily lifestyle change, it has the potential to bring your blood pressure to normal. And the next question that should rise in my mind, that what do you mean by this lifestyle change? So to be very frank, it's doing all those things we don't want to do. That is, we have to wake up early and have a morning stride for 30 minutes. And if I put it in a figure, the thing that we tell my patient is, you walk for 30 minutes for 5 days in a week, you take 2 days break in the weekend. And then that walk also shouldn't be like a slow walk. It should be at least jogging, if not
Right.
running. If you are able to run, you should run. But if you are not able to run, you should at least jog. Now the problem is, to the elderly population, I cannot always tell you to run or even jog. For them, if you are not able to even walk, if you have osteoarthritis or maybe some kind of disability in your legs, even walking for 30 minutes is better than doing nothing. If I'm not able to walk, you should not just leave it because I'm not able to jog and I am not jogging or I'm not running. You should be not sitting in your couch. You should leave that sedentary lifestyle. This is number one, and this is the most important part. And to add to that, I must tell you that some amount of isometric exercise, some amount of weightlifting, if I am putting it in the value, we tell our patients that if he or she comes to me before the age of 40, I tell them that you should take at least a weight of 5 kg in both your hands and do it for at least 10 minutes a day for 5 days a week. So if you are fit, physically fit, you should be having at least 40 minutes in your day, and you should be giving 30 minutes to the aerobic exercise, that is 30 minutes for jogging, 30 minutes running, and 10 minutes for some isometric exercise like putting on some weight. Not very much weight. If you are able to do it more than 5 kg is well and good, but at least 5 kg weight in both your hands for just 10 minutes a day. It's enough to bring down your blood pressure at least by 20 by 10. So this, I think, is one of the most important part of your life and BP management, that you take a very healthy lifestyle from tomorrow itself and not wait for some things to happen.
Don't be a couch potato.
Exactly. Don't be a couch potato. You should be doing those things that you are not feeling to do today, but you have to do it right from tomorrow. And I can assure you that if you are doing it from tomorrow, it is not going to reduce your blood pressure. It's going to boost up your health by a lot of factors that you cannot even imagine. So lifestyle, walking, and some amount of isometric exercise like lifting some weight is really going to help not only your blood pressure but your overall health. And also, to add to that lifestyle, I must tell you that your dietary intake has to be also very much measured.
Thank you, doctor. But if we talk about diet, we often see that people goes into anxiety who has hypertension and they want to lose the weight and they go for crash diet.
Yes.
So what food, vegetables exactly you are suggesting here, and are you suggesting a crash diet for those patients?
Okay. See, I want to be very much elaborate on this part because diet and lifestyle plays the most important part in the initial management of hypertension. So we often see patients that they are not only hypertensive, they have actually a lot of problems. I'm not talking about a disease per se, I'm talking about the patient. Maybe he or she having diabetes, maybe having a stroke, a kidney disease, heart failure. And mostly we find the patients to be extremely depressed because they are having a lot of problems in them. So my message to those people who are having a lot of diseases, not only hypertension but diabetes, hypertension, kidney disease, heart problems, sometimes neurological problems, uh, don't be depressed. There is always a way out, and you just try to stick to the plan given to you by the doctor and try to stick to a very healthy lifestyle that sometimes you will not be able to do the even 30 minutes of walking. You may be they may be bedridden, but diet, I think this can be applicable to everyone, to the pan every people, that dietary intake must be very very cautious. Now if I am starting to talk about diet, the two things that we talk is, number one is a low salt diet, and number two is dash diet. What is dash diet? It is nothing but a diet system that is designed to address the person with hypertension. So in dash diet, it was primarily made for the European people, but if I just apply it to our Indian population, the main take home message is you try to avoid processed food, canned food, and high calorie content. Like uh, we all like to take ice creams, cold drinks, pizzas, burgers. Well, they are all banned from your life from now on. I mean, if you are wanting to live a healthy life, then you must be stopping all those things. Apart from that, you must be trying to avoid, if not totally stop, the high calorie foods like mutton and beefs. You try to avoid high calorie diet dairy products, and also you try to avoid everything that is processed and stored for a long period of time. Try to eat fresh food. The thing that we advise our patient is, number one, eat chicken, eat lean meat, eat fish, eat vegetables, eat legumes, eat low calorie dairy products, and if possible, eat freshly made food. The moment you are processing the food and storing them, it store some amount of calories, store some amount of toxin along with them, that is not so good for your health. Maybe it is good for your taste buds, but it is not so good for your health. So if I am telling my patient about dash diet, the term I do not use in my practice because it's a little bit scientific and a little bit a technical term. But if I am telling them to eat what to eat fresh, don't process and don't store the food. Number two, coming to the low salt diet, I must tell you that when I'm telling a patient to go for low salt diet, the next question that comes, doctor, what food should I avoid when it comes to the low salt diet? So in the low salt diet part, often we talk about an amount of salt. We tell them eat less than 1.5 gram of salt, but this is very technical. I mean, how can we measure what is the amount of salt I am taking in a day? So the thing that I tell them to avoid is, do not eat fried food too much. It is very important that fried food not only takes a lot of oil, it actually absorbs a lot of salt along with it. So your fish fries, your burgers, your pizzas, those things, your kebabs, they are actually not only high oil, not only high calorie, but they are actually high salt also. In our Bengali population, we often eat muri.
Parched rice.
Yes, yes, and that, when prepared, if we go to the shops, we will see that they are frying it with some amount of salt and urea. That's a very common practice in throughout Bengal, I think throughout India also, wherever we are processing those things. That is also a very, very important factor. I am not telling you to totally stop it, but have a restraint. Eat as less as possible. Those muris is a very common practice all over the rural Bengal and most part of the India, that people will eat that even without our knowledge. So that's a very important thing. And I have seen patients I am really not being able to control it with a lot of effort, and he is or she is taking muri 4 times a day with lots of muri. He's thinking that it's very healthy.
Very healthy.
It's very healthy. It's very also cheap. It's another thing. It's very cheap in the rural part of our country. And the moment I tell that it is a problem, it's high salt, they stop taking it. 2-3 weeks down the line, their pressure comes back to normal. So this is why it is very important to know that what are those high salt food that I must be avoiding, and I must be telling my patients that it is not always important to totally stop them, but you must have a restraint on the high salt food.
So doctor, what is the biggest challenge in hypertension management?
I think this is the patient's inertia to stick to the drug list.
Is it okay to take generic medicines, or one should stick to branded medicines?
Well, if the generic medicine is controlling the blood pressure well, it's very much okay to take generic medicine.
When one should suspect secondary hypertension?
Well, when the age of the patient is less than 35, when one is having extensively secondary organ damage like kidney damage, heart damage, neurological problem at very low level of blood pressure and very early age.
So doctor, many patients worry that once they start taking BP medicines regularly, will it become a habit, or they should only take the medicines when they have the symptoms?
Oh, that's such a wonderful question. And the question we face every day in our clinic. Yes, one should take the blood pressure medicine every day. That's a clear-cut message to everyone. You have to take the blood pressure medicine every day. But yes, it can be stopped. It does get stopped, but only because of the prescription made by your doctor. It is not a habit, it's a necessity. You have to take the blood pressure medicine because you need it. So you have to take the medicine daily, and it is not a habit. I must emphasize, it's not a habit. You have to take it.
Wonderful. So doctor, if a patient misses their dose of BP medicines, what should they do?
Okay, first answer is, you never take 2 medicines at once. But if you are taking a single medicine in a day, and if you have missed the dose in the morning, you can take it in the latter half of the day if you are not taking another medicine. But if you are taking, say, one medicine in the morning, another medicine at night, and if you have missed the morning dose and you are remembering it in the evening, you must not take 2 doses at the same time.
So listen to your doctor, no double dosing, just take it next to your dose. So doctor, one question comes up a lot, that those patients who are looking for natural remedies, can high BP be cured at home with natural supplements?
Well, it's still under a lot of investigations, but there are some proposed therapies like vitamin C, cod liver oil, um, lemons. But I think one must go forward with those treatments only after the supervised treatment protocol from a registered medical practitioner, but they are not that much approved till date.
So, doctor, to wrap up today's discussion, a person with hypertension, how many times they should visit a doctor in a month?
To start with, I will tell that as long as the BP has not been controlled, once a month visit to the doctor is enough. But once it has been controlled, I think in a year, at least 3 to 4 times you must visit the doctor. But you must remember that not only visit the doctor, measure BP at your home also.
So, lastly, doctor, after all this discussion, what do you have to tell for the common people about the awareness of hypertension?
So this is very important because that's what we have been talking the whole day. So hypertension is something that you will probably be living your whole life. Do not take too much stress. Do good amount of exercise. Take healthy food and take your prescribed medicine in a way that the doctor has been telling you. Do regular visits to the doctor. Measure BP at home. Take a good amount of sleep at night. Do not take excessive stress. Take breaks from your hectic duty from time to time. Go out, meet with your friends, meet with your loved ones, and take some vacation from time to time. Remember, it is not only treating the hypertension, it is having a good and healthy life and a happy life.
So, doctor, before ending today's conversation, as a commoner, what I should do to keep my heart healthy?
Okay, yeah, that's very important question. See, your heart is a machine and it is doing its work right from day one, the moment you were conceived, not even born, and till the last day, the last breath you take. So it's a machine and it needs something to live its life. And what does it need? It doesn't need much. It just needs its own blood supply and its food, which is oxygen. And where does the blood comes from? The blood comes from the blood vessels. So why it is so much important to monitor your blood pressure, monitor your lipid profile, cholesterols, do healthy lifestyle? What is so important that I must be running 30 minutes in the morning to keep my heart healthy? How does it help? So I'm just taking a small example. Maybe you are walking down a lane and if you are walking in your own background and you see the main road that you take every day, it's blocked. So what do? You take a narrow lane side, a bypass, and you try to reach your home. So for heart also, if your blood vessels, the major vessels that are blocked, if they get blocked someday, the heart doesn't die immediately because the heart has its own bypass supplies. It has its own mechanism to survive. But those bypass routes are not always active. And in order to activate them, in order to recruit those blood vessels, you need to do the exercise, you need to take the healthy lifestyle. Well, why I'm taking the drugs? I am taking the drugs so that the main vessel stays active. And why am I doing the healthy lifestyle and diet? So that the bypass routes, so that the blood vessels, in case of an emergency, if someday they get blocked, your bypass routes to send blood to your heart doesn't stop immediately. Your heart gets some extra time to cope up with the reduced blood supply and your heart's function like a normal heart. That's why it is important that you take care of your heart, you take care of everything that comes with it. You take care of your blood pressure, you take care of your cholesterol level, you take care of your sugar, you take care of your daily lifestyle, you take care of your mental health, you take care of your everything as a whole. You take care of your body and mind. Thank you.
Thank you so much, doctor, for taking us through the vital insights of blood pressure, from understanding what it is, from there to take medical care or home remedies or lifestyle, everything. Thank you so much for today's discussion.
Thank you so much. It was very nice interacting with you.
সেম হিয়ার। তো লাস্টলি ডক্টর, আমরা আমাদের হার্টকে হেলদি রাখার জন্য কি কি উপায় অবলম্বন করতে পারি?
হ্যাঁ, মানে এটাই হচ্ছে সারমর্ম আজকের ডিসকাশনটা। সেটা হচ্ছে আমাদের হার্ট আমাদের জীবনের প্রথম দিন থেকে আমাদের সঙ্গে থাকে, সব সময় নিজের কাজটা করে যায় এবং শেষ দিন অবধি আপনাদের সঙ্গে থেকে যায়। এই হার্ট যে কাজ করছে তার জন্য এর দুটো জিনিস দরকার, একটা হচ্ছে রক্ত এবং 2 নম্বর হচ্ছে অক্সিজেন। এই রক্ত কোথা দিয়ে আসে? এই রক্তটা আসে হচ্ছে রক্ত নালী দিয়ে, যেটাকে আমরা বলি ধমনী। আমাদের এই যে হার্ট আমাদের প্রথম দিন থেকে আমাদের সঙ্গে থাকে, এর জন্য এর দুটো মাত্র জিনিসই দরকার। একটা হচ্ছে রক্ত, আর 2 নম্বর হচ্ছে অক্সিজেন। এই রক্ত এবং অক্সিজেন আসে কোত্থেকে? না, ধমনীর মাধ্যমে। এই ধমনী আমাদের যখন ব্লক হয়ে যায়, তখন হৃৎপিণ্ড চেষ্টা করে যে আমাদের কোনো বাইপাসের মাধ্যমে এই রক্ত এবং অক্সিজেন যেন হার্টে পৌঁছায়। এবং এই যে বাইপাস উপায়গুলোকে, যেগুলোকে আমরা আমাদের ভাষায় বলি হার্ট কোল্যাটারালস, সেই কোল্যাটারালস গুলো কিন্তু আমাদের সবার মধ্যে থাকে, কিন্তু সবসময় এগুলো অ্যাক্টিভ থাকে না। মানে কি, এই বাইপাস গুলো খোলা থাকে না। মানে ধরুন আমি আমার আজকে বাড়িতে পৌঁছানোর চেষ্টা করছি, যে রাস্তা দিয়ে আসি সেই রাস্তাটা আজকে কোনো কারণে জ্যাম হয়ে গেছে, তখন আমি কি করব? আমি একটা ছোট বাইপাস রাস্তা দিয়ে বাড়িতে আসার চেষ্টা করব। হার্টের ক্ষেত্রেও কিন্তু ব্যাপারটা ঠিক সেই রকম। আজ ভগবানের দয়ায় না হোক, আপনার যদি কখনো এরকম হয় যে মেন যে সাপ্লাই অফ ব্লাড অ্যান্ড অক্সিজেন যেটা আছে আপনার, সেটা হঠাৎ বন্ধ হয়ে গেল, যেটাকে আমরা সাধারণভাবে হার্ট অ্যাটাক বলে থাকি, তখন হার্ট কিন্তু প্রথমে চেষ্টা করবে যে এই যে কোল্যাটারাল ভেসেলস গুলো ছিল, তার মাধ্যমে রক্ত এবং অক্সিজেনটা শরীরের হৃৎপিণ্ডে পৌঁছাক। এই কোল্যাটারাল গুলোকে যাতে খোলা যায়, যাতে রিক্রুট করা যায়, অ্যাক্টিভ করা যায়, সেই জন্যই কিন্তু আপনাদের সকালবেলা উঠে ওই 30 মিনিটের কষ্ট করে হাঁটাটা এবং আপনাদের হেলদি লাইফস্টাইল, যেটা আপনার ডায়েটের মাধ্যমে মেনটেন করার চেষ্টা করছি, সেটা করা। যদি আপনারা এগুলো করেন, তাহলে কিন্তু এই কোলাটারাল গুলো আপনাদের সবার খোলা থাকবে। হঠাৎ একটা বড় হার্ট অ্যাটাক যদি হয়ও, বা মেন রাস্তাটা যদি বন্ধ হয়েও যায়, বা ওই কোলাটারাল দিয়ে কিন্তু রক্ত হার্টে ঠিক পৌঁছে যাবে, এবং হার্টটা কিন্তু হঠাৎ করে বন্ধ হয়ে যাবে না। সো আমার বক্তব্য একটাই, হার্টকে ভালো রাখার জন্য শুধু হার্টের চিন্তা করবেন না, আপনি আপনার প্রেশারটার খেয়াল রাখুন, সুগারের খেয়াল রাখুন, কোলেস্টেরলের খেয়াল রাখুন, বাট তার বাইরেও একটা হেলদি লাইফস্টাইল করুন। স্ট্রেস থেকে বেরিয়ে মাঝে মাঝে বন্ধুদের সঙ্গে দেখা সাক্ষাৎ করুন, মাঝে মাঝে একটু ঘুরতে যান, এবং আপনার রাত্রেবেলা একটা খুব হেলদি এবং সাউন্ড একটা স্লিপ নিন। সম্পর্কে আপনার হার্টকে ভালো রাখতে গেলে আপনার পুরো শরীরকে ভালো রাখতে হবে, এবং তার জন্য যা যা করা দরকার সেগুলো নিয়ে আজকে ডিসকাশন করা হলো। আশা করি আপনাদের ভালো লেগেছে। ধন্যবাদ।
To our listeners, high blood pressure often has no symptoms, but it can lead to serious circumstances if ignored. So keep tracks of your number, follow a hearty, healthy lifestyle, and most importantly, listen to your doctor. That's all for today's episode of Heart Talks. Stay informed, stay healthy, and we'll catch you next time. Thank you.